If you are a person who is taking medicines for high BP, or if you know someone who is taking in the family or friends, then do one thing. Go check out the name of the medicines doctor prescribed to you. You will be shocked to find these names. Checked? Found any of these medications? Well, if you found, let me tell you about these. These medicines belong to the category of Angiotensin Converting Enzyme inhibitors. We'll refer them as ACE inhibitors in the video. I don't want to stress much about the pharmacology, so I'll explain it in a simple terms. Angiotensin converting enzyme is the responsible culprit here for the rise of the blood pressure in the body, and so we manage to keep in control by inhibiting it with the help of these medicines. These category of medicines came first, and doctors tend to prefer these to patients even though they know that it is associated with severe side effects. There is one more category of the medicine just like these ACE inhibitors that work to treat high blood pressure, known as Angiotensin Receptor Blockers, ARBs. So there is a conflict going in the medical field about these medications, saying which one is better and which one doctor should prescribe to the patients in these two category of medications if the patients are detected with high BP for the first time. Since many top international doctors came forward with this doubt, a group of researchers decided to conduct a study on it to clarify many doctors' doubt. Researchers say there is a long list of medications for high BP treatment, and guidelines recommend both ACE inhibitors and ARBs as a first-line option. The one thing to notice here is both classes have been proven effective in lowering blood pressure and reducing the risk of heart diseases and stroke. But doctors and patients are more concerned about the side effects they are facing out of these medication. Obviously, both doctors and patients prefer the medications which give less side effects. So few trials have made head-to-head comparison of the two drug types to help doctors make a decision on which to prescribe. Research team used a few large databases from the United States, South Korea and Europe with health records from nearly 3 million patients who were newly starting an ACE inhibitors or an ARBs sometimes between 1996 and 2018. The large majority, such as almost 2.3 million patients, were prescribed an ACE inhibitors as their single blood pressure medication. The rest, almost 674,000 patients, were started on an ARBs. Overall, the study found that there was no clear difference between the two groups of their average risk of suffering a heart attack, stroke or heart failure. However, ACE inhibitor patients were 3 times more likely to develop a condition called angioedema, where painless swelling under the skin is noticed, and 32% more likely to develop a persistent cough or continuous cough. In addition to these side effects, the risk of GI bleeding and inflammation in pancreas, known as pancreatitis, were also slightly higher among ACE inhibitors users. But those figures did not hold up to a statistical analysis the researchers performed, which means they could be chance findings. So when we compare ARBs with ACE inhibitors, the side effects noticed in ARBs is quite less compared to ACE inhibitors. So from this study, what the researchers are trying to say is, obviously most of the doctors prefer prescribing ACE inhibitors to treat high BP due to their years of personal experience. But patients should be aware that ACE inhibitors can cause cough and angioedema. And if you develop those symptoms, notice them as a side effects of high BP medicine and inform them to the respective doctor about it and let them take decision about it. If you got any doctors or medical friends in your group, don't forget to share our video to them. That's it guys, please do subscribe and press that bell icon for more updates from our channel, and don't forget to comment your opinion on it. This is your Vignesh. See you guys in the next video with one more interesting medical update.